Thank you everybody for coming, joining us both in person and virtually. My name is Ito Peng, and I'm the professor at the sociology department, and also the director of Center for Global Social Policy. We've got a great talk today by Izumi Niki, who is the fifth-year Ph.D. student in our department. And also she is one of the RAs who are working with us on the Care Economies in Context project and for the Center for Global Social Policy. Today, Izumi is going to talk about a sort of a research that's part of her PhD thesis. Her PhD thesis is titled Migrant Care Workers in Canada, Experiences, Meaning Making, and the Sense of Belonging. And her research is really based on a really in-depth, very highly qualitative research and ethnographic studies. So in today's talk, she will talk about navigating systemic challenges and exploring immigrant identities in ethnocultural care in Canada. I think it's really, really exciting. So I'm going to ask Izumi to sort of present for about 30 to 40 minutes, and then we could break it for a question and answer. So with that, Izumi, it's all yours.
Thank you. Thank you for the introduction. Thank you for coming. And people on Zoom, thank you for joining. My name is Izumi Niki. I am a PhD student at a Department of Sociology. And I'm also a registered social worker in Toronto, Ontario, activation worker, and migrant care worker. I am also a mother of 2 children. Today, I will present my research navigating systemic challenges and exploring immigrant identities in ethnocultural care in Canada. Next slide, please. I would like to start by acknowledging the land we are on, and as well as I am from. So as an immigrant settler to this land, I want to respectfully acknowledge that we have been living, learning, working on the traditional land of many nations, including the Huron-Wendat, the Seneca, and the Mississauga of the Credit. Also, Japan, my home country, owns colonial, imperial, and occupational imprints in Asia-Pacific regions, including the indigenous people of Ainu and Ryukyu. Today, this meeting place is still the home of many indigenous people from across Turtle Island, and I am grateful to have the opportunity to work on this land. Next slide, please. So for today's agenda, today's presentation is related to my dissertation project, but in this presentation, specifically, I will incorporate my experience and my life history. This is because my personal life and professional career and research topics is inseparable, and it is necessarily to explain what and why I am working on this topic. And I will present around 30 minutes, and I would like to have an open discussion with all of you, including people on Zoom, about care and care work after my presentation. Next slide, please. So just a brief background, my personal history. This is my mother holding, it's not me, this is my sister. My mother was a nurse, and I witnessed her emotional labor when I visited her workplace when I was 6 or 7, I don't remember. The reason for visiting her workplace was not to see her work. I had to miss school due to sickness, but my mother was not able to take time off from work to take care of me. And we didn't have a sitter service in Japan back then. Anyway, so at the hospital, I witnessed my mother's emotional labor, but it was more than that. I thought she had another personality. She was a completely different person. She was always strict mother and often upset with my sister and I, but at her workplace, she was a soft-spoken, nice, and gentle nurse. Later, I found this is what Early Hochschild later called emotional labor, but I feel she is more than that. It's not like an emotional work or emotional labor, but I still feel she has two different personality, work and home. So several years later, when I was in undergrad, I started researching about emotional labor in Japan, first by the nurses and then paid care workers. After interviewing more than 30 paid care workers for my MA research, I was completely attracted by their narratives, how they understand their work, and how they interact with older adults, especially those with dementia. Then I decided to work as a care worker without any certificate or any experience. I just asked the workplace where I was doing the ethnography, and they accepted me. My plan was just to work maybe one or two times a week for a few months to get to know the job. But I ended up working there for 5 years and got certified as a care worker in Japan. At the same time, I noticed how difficult it is to work as a mother in Japan and as a woman, which eventually led me to immigrate to Canada as an international student. After coming to Canada, I still work as a care worker, and I have been in this sector for many years now. Next slide, please. So this leads to my research question. My personal research question is, despite the working conditions, why am I attracted to care work and I am unable to stop engaging it? But more operational research question is, what are the experience and the effect of care work on care workers? Okay, next slide, please. I would like to give you a brief background of how diverse the Ontario population is. Ontario's population is increasingly diverse. In 2023, 34% of population identifies as visible minorities, and 30% of the population are immigrant. In Ontario, there are around 630 long-term care homes, and within that, 50 to 60 of them are ethnocultural long-term care homes. This includes religious-based homes. Ethnocultural long-term care homes typically provide culturally appropriate services, such as having staff speak the same language as the resident, serving ethno-specific meals, or delivering cultural or religious programs. According to Ontario government, they have longer, next slide, please. According to the Ontario government, they have longer wait lists than the regular homes. The admission to LTC home is based on the assessment and priority criteria, so the wait time may differ from people to people. But some wait few years, more than 10 years after their application to the admission. Next slide, please. To clarify the field I work, I will briefly explain about Japanese Canadian community in Canada. While the first Japanese immigrants settled in Canada over 150 years ago, today people with Japanese ancestry make up relatively small community. According to the 2021 census, there were about 130,000 people in Canada who self-identify as having Japanese heritage, comprising 0.36% of the total Canadian population. Japanese Canadians tend to concentrate in the provinces of BC, 42%, Ontario, 33%, and Alberta, around 14.5%. Currently, 2/3 are descendants of pre-war migrants, who identifies second to fifth generations. And 1/3 are post-war immigrant from Japan since 1967, when Canada opened its border to Japanese people. Among them, 76% of all Japanese immigrants since 2000 were women, and 80% of them are mixed marriage. Marrying to non-Japanese, which is more higher than other visible minority group. Next slide, please. I am currently working in one of the ethnocultural long-term care home for older adults as an activation worker. I am now working as a casual worker. And I wanted to let you know that there is no long-term care home specifically for Japanese Canadian or Japanese speaking people in Canada. In Toronto, there is one supportive housing for Japanese people, which is an apartment complex with light care assistants. And there is 25 beds within Chinese long-term care home. Activation worker only consists of 4% of all the workers in LTC home. And usually there is 1 to 2 workers in one floor. So to my institution, there is 50 residents in one floor. Next slide, please. So here is the sample of weekly schedule of long-term care home programs. Activation workers are responsible for planning and delivering the regular programs, as well as special programs such as events, outings, religious events, and so forth. So this position is very close to residents, family members, and volunteers. Next slide, please. Okay, research question again. So what are the experiences and effect of the care work on the care workers? To answer this question, next slide, please. For this presentation, I will include ethnography and autoethnography as a data. So this include my experience working at long-term care home, assisted living, and volunteering at social service agency and community engagement, such as a member as an choir group in Japanese Canadian community. Next slide, please. My research was guided by these theoretical frameworks, including critical feminist perspective and intersectionality. I would like to highlight a concept of care as a connective labor. According to Alison Pugh, connective labor is a work of creating and sharing an emotional acknowledgement of another person through a process of seeing or reflecting them in order to create value, certain value. Pugh emphasizes that connective labor is an interactive process where both the worker and the recipient contribute to shape the meaning of the encounter. This concept can capture the existing care paradigms, such as skill that can be and needed to be trained, the perception, which is understanding and reflecting the perspective of others, and mutuality, which is shared emotional experience and co-construction, both by the caregiver and care recipient, and inequality, the impact of power dynamics and social inequality on the experience and execution of emotional labor. Author proposed connective labor as a more nuanced and inclusive lens for analyzing the politics, inequality, and transformative potential of care work. Next slide, please. By examining my experience, data, and narratives through these frameworks, a few things emerged. Within those, I will explain 4 findings today. So first one is ethnocultural care facility function as a society's buffer. And second, lower salaries and immobility of the workers. And third, performing holistic labor by the workers. And number four, more unpaid work in the paid work setting. First finding, ethnocultural care facilities and social service agencies are working as a society's buffer for both care receiver and care workers. On top of ethnocultural care providers provide culturally, linguistically catered care for immigrant care receivers, which are sometimes more work than non-ethnocultural organizations. Care providers recruit immigrants as a care workers by providing caregiver training and often visa support. This is to recruit more care workers in their organization, but it also contributes to broader society to fill the labor force in care sector. Also, this could be a burden for smaller communities where they don't have enough resources to do so, such as training or hiring. They often face systemic challenges. Ethnocultural care facilities, often those operating with public funding, must ensure they have sufficient users and generate a sufficient level of revenue to sustain their subsidy. So it is also challenging to build a new facilities as a significant funding, approximately half of the whole budget is required to build a new home. So this makes the operation of ethnocultural care facility and social service agency more difficult for smaller communities. Next slide, please. Second, therefore, workers in the ethnocultural facility and social service agencies depends on workers' passion and their immobilities. Some ethnocultural agency salaries are lower than in other facilities. Therefore, those with labor market mobility, such as younger, with language skill and education, move to higher paying facilities or change their occupation within care sector, or even move to different industries outside of care sector. Some of the remaining workers have a sense of immobility, such as this is all I can do, or I can only work here due to different barriers. On the other hand, some people who are more financially stable may stay in smaller homes because they are willing to contribute to the resident and the community. So this shows that this industry depends on the motivations and passions of the workers. Next slide, please. Thirdly, I found they use a whole self as a worker, in another word, performing holistic labor. People working in ethnocultural facility make use of their racial and ethnic characteristics and language ability in their work. For instance, for myself, being Japanese, understanding Japanese culture and using a Japanese language. This can turn my disadvantage in Canada, such as a language barrier, into an advantage, an asset. Some people working in ethnocultural facilities do not separate work from their life. In addition to their paid work, many people volunteers in the same field or take part as a board member of the smaller organizations. This shows that the salary is secondary for some people and that the motivation to contribute to the community is very strong. Some workers overlap their clients with their parents in their home country, Japan. Next slide, please. Lastly, they do more unpaid work in the paid work setting. Because of their holistic way of working, they often do more than they are assigned to do or what their job description says. I feel community size also matters because if the community is small, they know that if they do not step in or help their clients, there are no other resources or no one available for them to help. Eventually, this condition can lead to burnout of the workers in smaller communities. Next slide, please. So I would like to pose 3 discussion points from these findings and the implication for my future research. One is care work has a significant impact on a sense of belonging and identity. Second is work as a subtle mode of resistance and activism. And third is the invisible exploitation of smaller community and their members. Next slide, please. Number 1, care work has a significant impact on sense of belonging and identity. The face-to-face nature of work may strengthen the desire to support them as Japanese or Japanese Canadian, especially when they are thanked by the individuals or their family members, or when they see their living situation improve. This will motivate them in working setting. Moreover, by engaging with community through their care work, they, including myself, learn about their history and develop a sense of belonging, sense of being a part of the community. Knowing them strengthen their desire to use their knowledge of the language culture to contribute to their community in Canada. For instance, I learned about the history of internment camps during World War II, discrimination before and after, and redress movement through working in the Japanese Canadian community. So this is the book gift from my resident who passed away a few years ago, and it has all the history of and the Japanese Canadians, and she marked this photo is related to her, and she gave to me before she passes. So compared to the time I did not engage in care work, I feel much closer to people in the community by hearing their experience, feeling, and knowledge. Next slide, please. Next discussion point is care work can be considered as a subtle mode of activism to resist Canada's Western-centered norms. In Canadian society, under Canadian regulation, it is sometimes challenging to provide ethnocultural care. For instance, food, holiday, religion, language is different. So worker need more effort to offer their culturally normal life in Canadian context. Coordination, negotiation, and awareness raising with management and ministry are sometimes necessary, and negotiation require high skill of communication and advocacy. So these could be considered as an undervalued skill for implementing client-centered care. I believe this work can be described as a subtle mode of activism to resist Canadian society's Western norms in long-term care setting. Lastly, next slide, please. I see there are invisible exploitation of smaller communities and their members. As briefly mentioned, ethnocultural social service organization and facilities in smaller communities are more likely to face challenges. Nonprofit organizations in Canada are supported by donations and volunteers, as well as public fundings, but smaller communities are less likely to have resources and more difficult to obtain these support from the community. As a result, staff are paid less, hired in unstable conditions such as part-time or contract basis, and some are burdened with overwork. The current marketized system of nonprofit social service organization relies on the motivation and enthusiasm of members of the communities, which could be considered as an invisible exploitation. I think care work should be compensated, not only because it is physically demanding, but also because it is face-to-face work and sometimes it has a psychological impact on workers, and it has a core value in care. And we should not forget that ethnocultural social service and facilities are functioning as a larger societies offering care. Next slide, please. To close my presentation, going back to my research question, why am I attracted to care work, and am I able to stop engaging it? I myself perceive care work as not just work, but also opportunity to learn the meaning of life and value of living. Through care work, I have met many people who taught me the meaning and value and the importance of human connection. I still remember the residents who passed away many years ago, and they developed my feeling of connection and belonging in the community, including Canadian society. So whether paid or unpaid, I believe this emotional connection with others exists. So I would like to know your experience and thoughts on care and care work. Last slide, please. I would like to express my sincere gratitude for my supervisor, Professor Ito Pen, committee member Cynthia Clanford, and Professor Melissa Milkey, but also all the residents, family members, and co-workers, and volunteers, and all the community members who taught me their experience and their history. Thank you very much.
Thank you very much, Izumi, for your presentation. Certainly very sort of thought-provoking and interesting. Now, I would like to sort of open the floor for question and answer, Q&A. So if anybody have questions, comments, thoughts. Feel free. I think Cynthia has her hands up.
Yes, I'm sorry. My camera is not working. I don't know why. It worked yesterday, so I'm sorry about that. I can see you though. So thank you, Izumi, so much for this talk. It's great to hear how you put together really explicitly your own experience and how that's driving your research. And I really like how you've separated and connected these two questions, right? And like really trying to use not just participant observation, but autoethnography as a method. So how understanding your own experience, but then the second research question is also, and a lot of what you said, understanding that your own experience might be similar to others, but might be different, right? So I commend that, and I really like that, and I learned a lot from the talk. I have a question. I love the way that you're dealing with the complexity of care as both something that has intrinsic value, but also extrinsically, these are so hard to say, these two words for me, are, low paid and casual work, and often leads to burnout, especially perhaps in co-ethnic care or culturally sensitive care that is not valued, and in small communities. And so trying to hold these two things together, right? Which there's a literature on, but not for co-ethnic care. I guess I would push you a little bit more on, like, for example, your own research question, your personal one. Why are you unable to stop doing care work? But also, why are you able to continue to do care work? Mm-hmm. Right? And that's kind of the flip side, meaning what kind of, okay, so clearly there's the personal relationship, there's the belonging part, it's activism, so it's motivating you, but what are the material mechanisms that allow you to do this? What kind of class resources do you have, or flexible schedule as a graduate student, or other things that I don't know, that I can't imagine right now? Because those are the two sides of the coin, right? So I guess, like, I think the first way you've asked the question is super important, but the other side as well. And then that leads to kind of also just thinking about the second research question about other people. How do their experiences and motivations shape, why they are burnt out, or their experiences in the job? or why they stay or why they go. I'm just wondering if you plan to interview people who have left the field as well, or maybe not left care work, but left ethnocultural care work, right? Because of burn, and then to figure out why. Yeah. So thank you. It's just some food for thought, and I'm looking forward to the discussion.
Thank you so much for Cynthia for important questions and comments. I really agree that I have something that the reasons I could continue my care work as a care worker. One is, as you mentioned, so in Canada, from 2016, I started to work as a care worker, but after around 2 years, I decided to leave. I was a full-time, until then I was a full-time care worker because I knew I couldn't continue. One is the risk of burnout, and the other is I could not see my career developing in that sector. So I decided to come to PhD program, and I was super lucky that I could get in, and I have a financial aid on that. And I was super lucky that I had this field of like people working, researching about care, and I could do my work. But within the care sector, I could not continue the work. So that was the reality of care work. And I feel people feeling they are stuck and they are immobilized in the care sector. And I have a participant, the potential research participant who moved to different sector and who also moved into non-ethnocultural care facility. So I will be doing the interview for them and ask their motivation for continuing working in this sector, but also moving from the ethnocultural care sector. And I think this is really important. There is something that people can continue in this sector, and it's really up to the personal condition. If they need more financial stability, they don't have choice, so they will move on to different career, or they will move out to the industry. So I need to look at both sides of motivation and outside factor. Thank you so much for the comment.
Any other? Well, I have a couple of questions to ask. So first is more sort of empirical, sort of factual question. The other one is just kind of thoughts around sort of the research itself. First of all, I thank you, Cynthia, for really good feedback. I think that's a really, what you raised, really important. So in terms of the sort of factual empirical questions, for the purpose of this presentation and analysis, how many people did you interview over what span of time? And I guess maybe I'm kind of slightly, I wasn't very clear. Sort of a lot of this ethnographic work that you have done has been done in one long-term care homes that you worked. Is that it? Or have you been, have you been to other long-term care homes that in Toronto or in different cities? So that's my first question. It's just simply empirical thing, just to sort of get more information. Second question that I keep thinking is, so in a way, I totally understand sort of the importance of cultural specific care. I wonder, it would be very interesting to know to what extent sort of the kind of findings that you found, those threefold findings, to what extent is it sort of unique to cultural specific care workers, and to what extent it is also kind of universal to all care workers, right? And how would you be able to delineate that sort of differences or nuances between cultural specific care workers versus, how should I say, mainstream? Well, or not. I mean, it's also different culture, right? But so I just want your thoughts on that.
Yes. So my presentation today is based on my experience, and I've been working in care sector from 2016 to now, and I've mainly worked for 3 different settings. And one is Toronto City owned home, and one is ethnocultural home mainly for Chinese migrant, and one is for assisted living for Japanese people. So that, and by working in Chinese cultural care home and Japanese assisted living, I felt the difference. I know that the pay is different, and I wonder why. Because they are similar, they are doing similar things, but their size is different. One is unionized, one is not unionized, and their working condition is very, very different. And I wonder what is happening within this sector, even it's very small. And I found the difference between maybe the population size. It's still assumption though, but I feel, or because maybe Japanese community is smaller, and then they face more challenges to sustain their institution. But at the same time, all the care facilities are facing difficulty in sustaining their institutions and services. But to look at them in like micro level, there is a difference within long-term care sectors. And I question myself, is it worth looking at them? And I don't have an answer yet, but I feel there is something that I could apply to broader context for broader care sector in Ontario or Canada or even internationally. One is a marketization of care and care work has some limitation and negativity, and some people has to pay off that negative side. And currently workers are taking that job. And I feel that is related to power difference and systems of the society, how we see care and long-term care. So I'm not really answering your question, but
yeah, I was thinking that, in sort of care and care work literature, we often talk about the sort of sense of connectivity, the same kind of question that you raise. Despite the low wage, the poor working condition, there is some, not all, but there's some care workers really do feel committed to, and continuing to do that care. So my thought was that it sort of to what extent that commitment is based on sort of the individual characteristics that are sort of really more in tune with care work versus is to what extent that is more culturally specific to, say, Japanese, sort of cultural specific care workers or Chinese specific care workers. and so that's one thing. The other thought that I had was, to what extent is sort of having that cultural understanding actually sort of changes the nature of care itself. In other words, is care itself fairly sort of culturally specific, and if so, how would you explain that cultural specificity, at least from your experience? I'll stop here, but and I know Alexa has her hands up, but I will let you answer first.
This is a really difficult question because connectivity, we can find reciprocity and neutrality care in everywhere. And I think that's a core value of care, and it's really important. But on top of that, as a migrant care worker, I was kind of like healed by the communication with the residents. And that feeling of like healing or therapeutic connection, I think I don't know if this happened because of the ethnocultural care setting. It could happen within non-ethnocultural care setting. I don't have answer yet, but there are people who mentions about their feeling of belonging or closeness to their clients, and they build the sense of community, or they build a like sense of contributing, motivation to contribute to the community, and that driving them to continue or even more work in their community work. So I think there are something in the ethnocultural care, and I would like to see it more in my dissertation project.
I think this is a really interesting point, and I would love to learn more about that. Yeah. Okay, Alexa.
Yeah, thanks so much, Izumi. I've been, talking with you and following this project from the early days. So it's really exciting to see how it's developing and hear about some of your findings. As you were talking, I was wondering a little bit about the relational aspects of care between unpaid and paid care workers in the home. I know you weren't specifically talking to family members in this project, but I was thinking, in smaller rural communities, I've been seeing some literature on how when workers know family members, and when members of a small community all know each other, that can shift some of the dynamics within long-term care homes and residential settings, in the sense of, it's not just this sort of barrier, this hard barrier between workers and family members, because as we care scholars know, family provide a lot of care as well. And I was thinking, although this is your works in Toronto, this is a small community. And so I'm interested just if you could speak a little bit about some of that, if anything came up, those relational elements of care between family members and care workers. It may not have come up, but it just was something I was curious about, and wondered if you have time to speak about a little bit. Thanks again.
Thank you, Alexa. And thank you for your feedback throughout my project. So yes, unpaid care is a very important aspect in long-term care home by family members or volunteers. I think long-term care sector sees them as a work or labor, or and we or institutions expect to have unpaid labor by the family member or the volunteers, because we don't have enough staff and we are always facing a staff shortage. And people do come in and help workers. And sometimes because Japanese Canadian communities is relatively small, if workers are working for long term, people get to know each other, and people build a relationship. We do have border as a care worker and a family member, but family member do and workers do have an emotional connection, and some family member come in after their parents or the relatives pass away to help us because they have like so much connection to the facility, all the staff. And I've received so many emails or letters like thanking our work and thanking our involvement in the last days of their parents' lives. So, and workers also build a community. Workers are also members of the community, and it sometimes makes them difficult to work in a smaller community because the line between work as a worker and as a community member is blurred. So sometimes in the private settings, they will ask me or other staff a question about how long-term care home works, or the social service, like a question about social services, or like we have confidentiality policy. So we cannot disclose about the information about the patient. However, people in the community knows who's in the long-term care home, and they asked me how they are doing. So it's kind of set me difficult position, and I sometimes have to deal with it in a very ambiguous balance between being a member of the community and being a care worker. So that's, I think, very interesting and unique for a smaller community, or maybe in a rural setting that is more upfront. So I think that's a very interesting as a researcher.
Yeah, you have.
Thank you for your talk, and I'm very happy to now learn much more about your work. I found that your jury findings are each of them are really super interesting. But in my reading, the third finding, which is invisible exploitation, like the burnout, the possibility of burnout, maybe unintended, exploitation, is in my reading, it seems like in your research setting, it seems like is a kind of result from the previous two, two factors, which is a sense of belonging and also this, as an activism, like practice as an activism. But I also noticed though you had your own first-hand experiences as a care worker in Japan as well, so you have more broader experiences in this, this industry, right? And also cross-national, experience. So I was wondering, do you think it's a specific or is it unique to this ethnocultural care industry to experience this invisible exploitation? But I also I'm aware of that it might not be the case. I assume that it is pretty prevalent in care industry and also any other industry that that are fed by like people's passion and their love and so on. So I want you to hear more about this third finding from your research, and then I'm going to hear more the insight.
Yes. Thank you very much for a very important comment. So invisible exploitation is relevant in any care setting, like anywhere, internationally, globally, and in Japan too. So we have a literature that focuses on the invisible exploitation of care workers in Japan too. And I found similar things are happening in Canada. It's slightly better, it's similar things are happening. But when I compare a smaller setting, smaller community agencies or smaller long-term care homes, I see it's more apparent in those settings. And I wonder why. And there's something systemic reasons to it. And I would like to know what that means to survive or live as a migrant in a smaller community in Canada. So yes, it is international and it is global, and it's not only for the care setting. It's prevalent in any sector that uses their motivation or passion to work.
Go ahead. Well, could you say your name also?
Oh, yes, my name is Young. Can I just have a quick
Yeah,
follow-up?
of course, of course.
Yeah, but in your research, it framed as the result of the, there's something unique to this ethnocultural, setting, right? So, but you're saying this so just, I guess, clarification question. So this individual exploitation that in your research is more like resulted by this, this characteristic in this ethnocultural or cultural sensitive cares, right? That's what you are more like.
Yeah, it's more prevalent. I see more in a smaller setting.
I think this is really interesting point that you're raising, because seems to me what you're raising is that there might, and in your answer, is that there might be two slightly different variables or factors that are that might be interacting with each other. One is the cultural specificity, right? So the question about to what extent is this that the unique or not unique to cultural specific caregiving, vis-a-vis maybe Japanese culture, maybe Chinese culture. And to what extent is it about the small community versus big community? I think that was some of the questions that was raised and pointed out by Alexa and you too. And it might be that these two factors are both working, and it will be so interesting to see how they may interact, and whether it might be whether it would be possible to sort of disaggregate the works or dynamics of these two variables. I think that would be very, very interesting.
Yes, exactly. Yeah. So I think exploitation of their motivation and passion is prevalent in like everywhere, but there are something on the smaller community or like smaller social service organizations, and because of the systems of the management, and it is more prevalent in those settings. And yeah, and because of the immobility of the worker, some people can escape from that condition, but some people may not be able to escape from that condition because of the language barrier or Canadian work experience or education. So I see that is happening in smaller communities.
Interesting. Yeah. Any other? Oh, Elisa. Oh, no. No, it's okay.
I had a question that was also kind of related. But more
could
so
you
about,
give me your name?
I'm Firdaus, we're in the same. About when you spoke about holistic work and how that leads to like more unpaid work because you're kind of pulling from personal experience and you can't separate. I was also wondering, like from your work in Japan, because I'm assuming the care work in Japan is still culturally specific, even though they probably don't use that word because it's the whole population, but it probably has a lot of that. So like, did you see a lot of that same dynamic that leads to unpaid labor in the Japanese context because they're also kind of pulling from cultural knowledge? Or is that more so like kind of what you said, like from the minority context where you have like less labor that's qualified for that?
That's very interesting. And I remember here in Canada, some people say we like this institution because workers do care in Japanese way. So they do like more, they are polite, they're gentle, and they have like expected Japaneseness in care. And that is kind of like a standard back in Japan when I was providing care. And I see that like similar things are happening like in Canada, even in Canada, Japanese communities are expecting the Japanese way of taking care of them. And yes, in Japan, we have a lot of unpaid care work within paid care. And it's very similar. I think it depends on what a care receiver expects to receive in care and what Japanese Canadian society is expecting in care work. And I don't have an clear answer yet, but I feel something is different from non-ethnocultural.
Yeah. Yeah, I was gonna
Care.
say if you're observing like similarities, that can help the argument.
And interestingly, non-Japanese people are coming into that facility, even they don't speak Japanese or they don't eat Japanese food, because they hear the quality is good and staff are better. So they apply and they come in. And they don't have, interestingly, they don't have like a rigid eligibility to be admitted in that facility. If they want and they have a needs, then they need to accept people from outside of the community. So I would like to research on what is Japaneseness that they are looking for.
So on that, I have one more question. I know we're pushing the time limit, but
I thought we have until 1:30.
I'm thinking at the beginning of your talk, you said something like what 80% of Japanese have intermarried
Yes.
with other people,
Yes.
right? The other ethnicities and race. So in light of that, if 80% of the Japanese Canadian population is intermarried, what do you see the future of the sort of cultural specific care and caregiving for Japanese Canadian communities
Yes.
when they are no longer, well, I'm not sure
longer speak.
how Japanese they are.
Yes, it's very difficult to capture what is Japanese, being a Japanese in Canadian society, because pre-war migrant is becoming third, fourth, and fifth generation, and they don't even speak Japanese, or they don't really want to eat Japanese food. But still, they want to apply for Japanese related to care facilities. So that's very interesting. And then there is another population who is post-migrant, is aging, and they tend to forget English. Or so there's two different population within Japanese community, and sometimes they are separated. They are not really mixed. And 1/3 of the population who speaks Japanese often doesn't have family members here. So they sometimes need more support from social service agencies. But another population, 2/3 of the population, has contributed to build Japanese Canadian society in Canada, and they are really proud of being a part of Japanese community. So there is very like balance is really ambiguous, and also second generation has contributed, donated so much money to build a Japanese assisted living, but it said that fourth, fifth generation are no longer related to Japanese Canadian communities. And 1/3 of Japanese population, post-war migrant, is very poor. So they don't have enough donations to raise, or they cannot involved in the community because they are too busy working or like living. And so I don't know about the Japanese Canadian society's future, but there are two different populations within this small group. So it's very diverse and it's very interesting to research. And I think it is applicable for another population, smaller populations as well.
Interesting. Christine?
I think
Oh,
Cynthia's on.
Cynthia. Cynthia, you have your hand up.
Sorry, I can defer to other people if they haven't asked a question yet. I can't see the room, so you want to, somebody want to go ahead first?
Oh, thank you so much.
Yeah.
Yeah, Christine, go.
I'm Kriti. Izumi, thank you so much for the talk, and it was so relevant and insightful at so many different levels. My mom was a homemaker. She has been a homemaker all throughout her life, and I cannot thank her enough for the emotional labor she's put into raising us. But this is just a reflection of the discussion we were just having. So you mentioned that there are sort of these two groups of Chinese immigrants. One is they're like more settled, wealthier, pre-war immigrants, and the other is like relatively, I won't say poorer, but there is this, these are these two groups, and I wonder what's the impact of this on the dynamic of social belonging. So I see social belonging as maybe belonging to the community versus sense of belonging to Canada. So maybe it's like a reverse cycle for people who are who have been here for a long time. Maybe this space sort of acts as a site of sense of belonging to the community. And for the people who are newer, this site sort of acts as a sense of belonging to the country via the community. So I wonder if this is something that you could think about, or if this is relevant to the project. It's just, I was just curious to know what impact it would have on, because that was something that you touch upon, the sense of belonging.
Yes, I use the community so many times today, but there is no clear, like, what is community? Like, what is Japanese community in Canada? People, there is no neighborhood that they live together, and they are spatially dispersed, especially after the World War II. Most of them were lived in BC up until the Pearl Harbor, 1941. And then after the war, they are dispersed all over to the east side of Canada. So the community has collapsed, and they built the community after the community. But I don't know what that means. I think it depends on the people. What is community for you? If I ask this question, it's probably the answer will be differ to person. And I think you raised a very important point that for the newer immigrant, the sense of belonging and being the community means totally different from the pre-war migrant. And yes, I don't know the answer yet.
And there can be so much of an overlap between the two belongings.
Yes.
For sure. So, Cynthia?
Oh yes, just I was just gonna say, like the last speaker, I think really delving into what you mean by belonging, that the care worker feels this belonging by doing ethnocultural care is would really be where your contribution shines through. And it's a space, as the previous speaker said, to talk about different kinds of belonging and different mechanisms of belonging. If belonging to Canada comes through belonging through the community, and you can think of the counter argument, not just in other mainstream care workers or care workers in Japan, but also other immigrant care workers for whom the literature suggests care work is not, it is exactly the opposite of a site of belonging. Even if they might have, you know, good relationships with residents and they care about the work they do, there's also a lot of racism. There's a lot of, you know, there's a lot of tension with the people they care for as well. And so that's not a site of belonging intrinsically or extrinsically because they have precarious work. And so this piece of belonging, because they, like you said, the invisible kind of exploitation, also the kind of the reality that care workers both care about the work they do and they're paid low and that they're always juggling this, that we find in the larger literature. And so maybe it's really like figuring out what this belonging piece contributes to that. Like, does it intensify the invisibility or something like that? But the whole belonging piece seems like a huge contribution. The other comment I was just going to make is just Donna Baines has written about care work and activism. And so she's a labor studies scholar with a background in social work too. And so it's written about how care workers are advocates and the meaning that they gain as through advocacy also keeps them kind of in the job and self-exploiting themselves. So looking at that could help you connect what you're talking about, this particular advocacy, given the heightened maybe invisibility of co-ethnic care or culturally sensitive care. And how the belonging, like thinking of all these findings together. And I think that was Young Rong's point. Like, what's the relationship between these findings? I didn't quite see the relationship she suggested, but I think that thinking about their relationship is like important for you to go and maybe even centering the belonging thing, because this is a story not just about culturally sensitive care, but about immigrants, aging immigrants, but immigrant workers, right? As you kind of started with. And anyway, I think also the Japaneseness is important in terms of like the language and the food, but we also know these tropes kind of circulate, you know, so if people are arguing that Japanese workers are, you know, the best, most caring workers, I mean, those are tropes that circulate and get attached to certain groups of workers at certain times, problematically so too, right? So like even delving into that, would be a contribution, I think. So anyway, it's going to be it is a great project and looking forward to how it's developing.
Thank you, Cynthia. Thank you, Katie, too. Yeah, I think we have a bit more time, but if there's a question, yeah, go ahead.
I thought it was so theoretically rich, your presentation. You know, you began with child work. I'm saying it wrong probably. And I thought like there is from my reading, there's like a puzzle that's not answered in her work in terms of like beyond the like structures of exploitation, why do people do this work? And your work answers that question or responds to that question. I'm sort of seeing how you set it up with like an element of Japanese culture or custom or science. Like I'm thinking about that in terms of like Foucault's way of thinking about those elements as connected as like a special case. And you gave that example of higher like integration. That's not the right word. Obviously with risks there, which I'm not saying, but sorry, I feel like I have something that I really want that like is important to contribute. I'm just but you presented like a dual model, right? So from the beginning you linked your individual experience to your relations as well as to like the structural model. You know, you talked about the ways the state forces these frontline, last line buffer workers into a static position, like immovable was what you said. So I really saw you creating like a scalable social theory, one that connects to the individual, but also like the small nation, community or like culture, leaving that undefined, but as well as the nation state. So I thought that was really helpful, or not helpful is not the right word, but like quite theoretically rich. And then the last thing I'll just say, I was under, when you were talking about the variables, I saw sort of different variables embedded within the like case of the site that you studied at, as well as other ones, right? So a monocultural care home, if you think about Canada, I feel like an argument could be made that there'll be a higher degree of racism there, right? So and that is like a force that impacts everyone, irrespective of race, but also differently, and whether you're a care worker or a client. And so if you were to, like, what I see it, maybe I'll write this out to try to make it more coherent, but you might find that your case, like, you don't need to do another study because you're studying a special case where it's functioning to the greatest degree that it can within the like nation state structures. Does this make any sense?
Yes.
Yeah. Okay.
Wow, thank you so much, Ali, for your comment. Yes, monocultural care home, higher degree of racism. And working in the Japanese care home, they don't have to worry about the racism. That's a one thing that actually exists. And because they don't specifically say that, but it is a motivation to work in that ethnocultural care home. And but because they don't say that, like, we don't see like racism issue in that home, but I have to broaden my scope into mono or non-ethnocultural care home, what their work conditions or what their situations are compared to my condition. And yeah, set the discussion.
And you might find that, like, to use like data that you didn't collect, but mixed method data, that in monocultural settings, the outcomes are lower for clients and for workers. Like, there's more distress in those systems, or like number of falls, or just like those would be interesting things to
Right.
explore too.
Thank you.
Good. Any other questions, comments, thoughts? Okay, if not, I think we're coming very close to the end of the hour. So I'm thinking that, this is, I'm really pleased with and happy for your very good presentation. I think what it did was it raised a lot of issues and sort of started conversations about just not taking notes, but sort of from listening to the conversation. I think it raised sort of issues about, sort of what is culture, what is cultural specific care and caregiving, how is that different or same as sort of non-cultural specific care and caregiving? What is a community, and what are the factors? What are the sort of determinants or factors about culture, size of community, smallness, largeness, sort of more structural, institutional structures, and the caregiving. I think we actually try, in our conversation, we actually try to sort of understand these intersections and sort of variables. So I think it was really, really good. And I think what your research tells us is that there's, is that through your ethnography and autoethnography, you are actually able to raise the different dimensions of care and caregiving and areas in which we still need to explore. So I see it as a very rich and I know you're already beyond beginning of your research, but I could see it really, really sort of growing and building on this. So Thank you very much.
Thank you so
And
much for
thank
coming
you,
and
everybody, for your
comments.
comments, thoughts,
Thank
and
you.
questions for today. Thank you.
everyone.